been recommended this video to find out more about induction of labour. This may be in preparation for the end of your pregnancy, because you may have been recommended to have an induction of labour. This video will explain the risks and benefits of having an induction of labour, and also what you might want to consider during your pregnancy to help stimulate labour, including the option of a membrane sweep too. Video 2 will explain this process and what to expect from an induction of labour.
How does spontaneous labour begin?
The current thinking is that when your baby is ready to be born, they release proteins from their lungs, which initiates and stimulates the release of prostaglandins and oxytocin, which triggers the start of your labour and birth.
What is an induction of labour?
An induction of labour is where medication or devices are used to start labour earlier than when the body is ready to go into labour on its own.
Why have I been recommended to have an induction?
There can be many reasons why an induction of labour is recommended. Induction of labour is usually recommended because of a medical or pregnancy-related reason. Examples include high blood pressure, preeclampsia, diabetes, growth concerns for your baby, where the induction of labour aims to end the pregnancy safely without increased risks to either mum, parent or the baby. This also may be due to the end of pregnancy after 41 weeks, where the stillbirth begins to rise. Some women and people will choose to opt for an induction of labour too. The reason for recommending induction of labour should be explained to you by your midwife or your doctor with any time to answer any questions you may have.
How far into my pregnancy should I have the induction of labour?
You'll be advised the best time for your induction of labour. For the majority of women and people, this will be a date range and available to see on your Badger Notes app. Whilst we do our best to invite you in on the first day of your induction of labour range, there may be a time where this will be later in your range, which will help reduce your longer stays in hospitals for you. We'll call you to let you know when to come in and keep you updated on any delays. During this time, if you have any concerns relating to you, your baby's movements or any pregnancy symptoms, please call the Maternity Care Centre, which is sometimes referred to as triage.
How long can an induction of labour take?
There are up to 3 stages of your induction of labour: cervical ripening, breaking or releasing the waters, and beginning a hormone drip called synthetic oxytocin. The average induction of labour can take 2 to 3 days if all the stages are needed. This is more common if this is your first baby or if you're having an induction of labour at an earlier point in your pregnancy. If your cervix is already open enough after the first assessment to be able to break your waters or start the hormone drip, then you may be able to have a shorter induction of labour. Your induction timeframe may be affected by bed availability on delivery suite or the birth centre to be able to provide safe care for you. During busier times, this may be contributed by delays, but we will endeavour to keep you updated about your induction of labour and any delays as soon as possible.
Is there anything I can do to help stimulate spontaneous labour?
Whilst there's no guarantee that any of these will be affected, there is some evidence which highlights improved cervical ripening and a shorter induction of labour when women and people have tried these. You may wish to try acupuncture in the last few weeks of pregnancy, eating dates from about 36 weeks, or pumping with a breast pump for at least an hour a day from 38 weeks. In addition, some women may also consider these options at the end of pregnancy. Relaxation to promote the release of oxytocin, using biomechanics to get your baby into a good position for labour and birth. For example, swimming, yoga, or searching for biomechanics or spinning babies may help. Some aromatherapy oils in conjunction with relaxation complementary therapies. Speak with your midwife if you wish to discuss these options further. One intervention you may consider which has less risks and a higher chance of spontaneous labour starting is something called a membrane sweep.
What is a membrane sweep or stretch and sweep?
So a membrane sweep or stretch and sweep is a procedure where your midwife or doctor inserts 2 fingers with your consent into your vagina. They will examine and find your cervix and then gently separate the membranes of the amniotic sac from the cervix to help stimulate labour. This action encourages the release of prostaglandins, which are hormones that help to soften, thin and open or dilate the cervix, potentially starting labour naturally. A membrane sweep takes 1 to 2 minutes to undertake. Your midwife or doctor will listen to your baby's heart rate before and after the examination.
Where can a stretch and sweep happen and who by?
This can take place in the community from 39 weeks, but may be on an individual basis, be an option with your doctor in antenatal clinic, in triage or in the assessment unit.
What are the benefits of a stretch and sweep?
A membrane sweep may reduce the chance of medical induction in 3 out of 4 women having their first baby, and may reduce the chance of a medical induction with 4 out of 5 women who have already had a baby. A membrane sweep may decrease the length of pregnancy by 1 to 4 days, with 79% of women labouring within 1 week of a membrane sweep. It needs to be acknowledged through most of the research has explored women having membrane sweeps over 40 to 41 weeks of pregnancy, and having more than one membrane sweep was least likely to be effective in reducing a medical induction. If you have membrane sweep prior to your booked induction of labour and your cervix is open enough to break your waters, you may be able to be called from home straight into delivery suite or the birth centre to have your waters broken. This will reduce the length of time you are in on the ward. If your cervix is found to not be open enough during a membrane sweep, or you've not had a membrane sweep, then you will be invited into Hazel Ward for an assessment and to start the induction process.
What are the risks of a stretch and sweep?
If you have an examination and your cervix is closed, a membrane sweep is unable to be performed on a closed cervix. The most common experience from women is discomfort and pain. 63% of women report moderate discomfort. Breathing techniques and visualizations can be beneficial, and you can say stop at any stage if it's too uncomfortable. There's mixed evidence on whether a membrane sweep has any impact on the development of infection if your waters have not gone. A membrane sweep will not be advised if your waters have gone already. Other risks include vaginal bleeding and increased chance of having a start and stop labour.
What are the benefits of an induction?
The benefits of having an induction are to birth your baby safely to reduce the risk of continuing the pregnancy for either you or your baby. This also aims to avoid a caesarean birth, which can have risks both for the mother or parent and baby, and also for any pregnancies that you may have in the future. For more information on caesarean birth, please discuss this with your midwife or doctor, or check out the Royal College of Obstetricians and Gynecologists leaflet.
What are the risks of an induction?
There are risks with an induction of labour. Video 2 will discuss in more depth the risks associated with each stage of induction. Your chance of each risk happening does depend on your individual circumstances. The general risks of induction include a longer stay in hospital before your baby is born, increased bleeding after birth called a postpartum hemorrhage, an increased chance of an instrumental birth such as a forceps or ventouse. There's an increased chance of perineal tearing compared to spontaneous vaginal birth. There's an increased chance of infection to you and your baby, and a chance that the induction does not work and is unsuccessful. There's also an increased chance of baby becoming distressed, which may lead to a caesarean birth. There's increased monitoring of baby and vaginal examinations needed as well, and increased need for pain relief, including an epidural. For women with a previous caesarean birth, there's an increased chance of uterine rupture, in particular relating to the hormone drop of synthetic oxytocin compared with spontaneous labour after a previous caesarean birth.